Hi there, and welcome back to Soton Brain Hub. My name is Calvin, and today we're taking an in-depth look at the complexities of spinal cord pathologies, focusing on Spina Bifida. The term Spina Bifida refers to a group of birth defects that arise from the incomplete closure of the neural tube during pregnancy, which profoundly impacts the development of the spine and potentially the nervous system. Spina Bifida occurs very early in pregnancy, typically within the first month, during a critical period of development called neurulation. This is when the neural tube, the precursor to the spinal cord and brain, folds and closes. Failure of this closure at different points along the developing neural tube, cranial, spinal or both, leads to the various forms of Spina Bifida. Today we'll be discussing the spectrum of Spina Bifida, from the mildest to the most severe forms. Let's begin with the most common and often least symptomatic type, Spina Bifida occulta. Spina Bifida occulta involves a defect in the vertebral arch, the bony part of the vertebrae that protects the spinal cord. Specifically, it's a gap in the spinous process or a paraspinal cleft. The bony defect can vary in size and location, sometimes involving more than one vertebra. Often, the only visible sign is a small hairy patch, sometimes called a fawn's tail, over the affected area on the baby's back. The crucial point about Spina Bifida occulta is that the spinal cord and nerve roots are completely normal. They are contained within the spinal canal and are not affected by the bony defect. This means there are usually no neurological problems associated with it, and as such, individuals with Spina Bifida occulta often lead normal, healthy lives. Diagnosis is often incidental, meaning it's discovered during an X-ray, MRI or CT scan done for a different reason. Now, let's discuss the more complex forms of Spina Bifida, starting with meningocele. Meningocele presents as a noticeable fluid-filled sac protruding from the baby's back. The size of the sac can vary significantly, from small to quite large. The sac is typically covered by skin, though it may be thin in some cases, making it vulnerable to rupture. This sac is formed by the meninges, the protective membranes that surround the spinal cord and brain, the dura mater, arachnoid mater, and pia mater. These membranes herniate, or push out, through the opening in the vertebrae. The sac is filled with cerebrospinal fluid, or CSF, which cushions and protects the central nervous system. Crucially, in meningocele, the spinal cord itself remains within the spinal canal and is typically normally developed. Finally, we arrive at the most severe form of Spina Bifida, myelomeningocele. Myelomeningocele is the most severe form of Spina Bifida because the sac contains not just the meninges and CSF, but also a portion of the spinal cord and nerve roots. This represents a failure of the neural tube to close completely, leaving the spinal cord exposed. The severity and specific neurological deficits depend significantly on the level of the spinal cord affected. Myelomeningocele is often categorized by the location of the defect, lumbar, sacral, or even thoracic, with higher lesions generally associated with more extensive neurological involvement. In myelomeningocele, the exposed spinal cord tissue is called the neural placode. This represents a flattened, disorganized area of neural tissue that failed to properly fold and close to form the spinal cord. Thank you for watching this video. Remember to like if you enjoyed it, and subscribe to the channel for more videos like this and others related to the anatomy of the head, neck, and brain.